Your partnership with your doctor is one of the most important relationships in your life. And it doesn't just affect your current health. It shapes the way other doctors see you, the care you will receive in the future, and even health outcomes far beyond a single visit. Yet so many patients don't realize there are untold secrets doctors rarely share, secrets that can change everything about your care. Number one of the most frustrating things for doctors is when they think the visit is wrapping up and then just as they're about to leave, the patient brings up something major. Maybe it's, "Doctor, I think I caught an STD." Or, "By the way, doctor, I need something for my ED." These are important concerns, but by saving them for the last minute, you risk not getting the proper time and attention they deserve. Now we have entered a modern version of the same thing. A patient pulls out their phone and says, "I put my labs and symptoms into ChatGPT, and he told me I need 10 different scans and 15 blood tests. What do you think?" Or someone waits until the end of the visit to casually mention, "My smartwatch keeps warning me that my oxygen is dropping at night, and my heart rate is all over the place." Now, all of those concerns deserve a real conversation, but if you spring them at the very last second, there isn't enough time to explore them in detail. The secret here is simple. Don't have a hidden agenda. If something matters to you, whether it's embarrassing, confusing, or something your device flagged, bring it up at the very start of the visit. This way your doctor can plan the time to address it thoroughly, instead of trying to squeeze it into the last 30 seconds. Number two, a medical visit is not a game of Clue. Your doctor doesn't have the time to keep asking endless questions and guessing at every possible reason for your symptoms. So help your doctor help you. Don't hold back. If you have a family history of an uncommon or rare condition, say it right away. If you have had exposures at work, like chemicals or dust or radiation, bring it up. If your symptoms started after a tick bite or mosquito bite, or after starting a certain medication or supplement, or after eating certain foods, then mention it. Or if you already had tests done by another doctor, make sure to bring that information as well. Doctors are trained to look for answers, but with the time limits of a visit, they can't play detective for every hidden clue. The more clearly you share important details up front, the faster your doctor can figure out what's going on. Number three, many doctors are now using something called AI Scribe. This is a software that listens to your visit in real time and automatically creates the medical note. For doctor, it's a huge time saver. They spend less time typing and more time talking with you. But as a patient, you need to be aware of what this means for your record. When an AI scribe is on, everything you say can potentially be written down. That includes things you might not want in your permanent medical chart. Embarrassing personal details, casual comments, or even speculation can end up being documented. For example, if you say something like, "Maybe I'm getting Alzheimer's," it could be recorded as a genuine concern, even if you didn't really mean that. And if you share something about your sexual history or relationships, it might be included too if the system thinks it's relevant. The issue here is that once something is in your chart, it becomes part of your permanent record. It can be seen by other doctors, sometimes insurance companies, and it may even affect the way your care is managed. So what's the secret? If there's something you want to tell your doctor but don't want permanently recorded, say so. You can ask the doctor to pause the AI scribe or simply write it down for them so they can read it quietly. This way, you stay in control of what becomes part of your medical record. Number four is be aware of your digital footprint. Your medical record contains more than just what happens during your office visit. It contains voicemails and phone calls that are often transcribed and attached to your chart. So if you leave a rude voicemail, that becomes part of your permanent record too. If you don't show up for an appointment and fail to cancel on time, that no-show is documented. If your insurance company sends a letter saying you're not refilling your medication, it goes into your record. And if a doctor ever discharges you from their practice, whether for repeated no-shows or being disrespectful to the staff, that note can follow you to the next provider. Even outside the chart, your digital footprint still matters. If you go online and leave a negative or offensive review, your doctor is almost certainly aware of it. Unless you were truly harmed by a medical provider, avoid posting negative reviews. The rule of thumb is simple: praise in public, criticize in private. Your digital footprint will follow you. Make sure you tell the story you want it to. Number 5. Have you ever driven in a new area and suddenly the traffic slows down for no obvious reason? At first, it feels frustrating until you notice one driver squeezing between cars trying to pass everyone. And sure enough, a few minutes later, they are the ones pulled over for speeding. That's when it hits you. Aha! Everyone else slow down because they're locals. They know the speed traps, and by following their lead, you avoid getting caught. That same idea applies to medical advice. Your healthcare team is like those experienced locals. They know where the traps are, and if you follow their instructions, you will avoid unnecessary setbacks. For example, after surgery, when your surgeon says, don't lift anything heavy, don't bend in certain ways, and don't soak your incision in water for a few weeks, that's not just busy work. Patients who ignore those instructions and decide, I'm sure I'll recover faster than everyone else, often learn the hard way. Lifting too soon, bending too far, or even going swimming too early can damage the surgical site, delay recovery, or in severe cases, even require them to have revision surgery. So what's the secret your doctor may not be telling you? When you're given instructions or treatment recommendations, most doctors don't have the time to sit and persuade you why it matters. Let's say you have high cholesterol or osteoporosis and your doctor recommends medication. If you simply say no, the doctor doesn't have time to convince you that you need it. If you say no to the medication, they will probably just document in your chart, patient declined, and often that's the end of it. But here's how you can do better. If your doctor recommends a medication or treatment, don't just say no. Ask questions. What are the benefits? What are the side effects? What happens if I don't take this medication? Then let your doctor know. I would like to research my options and talk about it again next visit. By making it clear that you want to stay engaged and revisit the decision, your chart will show that you're an informed patient who is actively involved in your care, not someone who is simply ignoring medical advice. Number 6 is about conflicts of interest. Some patients don't realize that the way their insurance pays the doctor can create a built-in conflict of interest. In a capitated system, the doctor or clinic gets a set amount of money to care for each patient, and any money they don't spend, they get to keep. In an ACO, or Accountable Care Organization, groups of doctors and hospitals share in the savings if they keep costs below a certain target. That means doctors are actually making more money if they spend less money on you. So they're less likely to refer you to a specialist, less likely to admit you to a hospital, and less likely to prescribe newer, more expensive treatments, even when those options may be better for your health. Let me give you an example of how keeping you out of the hospital to cut costs can be a good thing or a bad thing. The good way is by keeping you healthy enough to stay out of the hospital. But the other way, the dangerous way, is by trying to keep you out of the hospital even when you really need to be admitted. For example, someone with a severe urinary tract infection might actually need IV fluids and IV antibiotics, but instead they're sent home on pills to manage it at home. That may look good on paper for costs, but it puts the patient at risk for getting much worse. Another example is with type 2 diabetes. In a capitated system, the doctor just has to show that your diabetes is under control, but they can demonstrate to the insurance that they saved money and even earned financial incentives by prescribing older and much cheaper drugs. They may treat you with an older medication that causes weight gain and low sugars instead of offering the newer diabetes medications that are much more expensive, but they do a lot more than just lower blood sugars. They can help with weight loss, protect your kidneys, and lower your risk of heart attacks and strokes. So in the end, the choice of which medication you get isn't always just about what's best for your health. It can also be influenced by what saves the system money. Yes, we should avoid wasting healthcare dollars, but also you need to advocate for yourself and make sure you're getting the care you deserve. Another very common conflict of interest even made front page in Rheumatology News. The article described how doctors in large healthcare systems are often pressured to keep all their referrals within their own network, even when the wait times to see a specialist are extremely long. Patients sometimes wait 3 months, 6 months, or even a year, while another doctor outside the system who takes the same insurance could see them much sooner. The article described the case of an elderly patient with severe and disabling pain who was told to wait 3 months to see a specialist, even though a nearby doctor outside the system was available. The patient faced a 3-month wait time and eventually demanded another option. The referring doctor didn't take the initiative. The patient had to demand it. And as the article noted, early diagnosis and treatment can make a huge difference, and delays of weeks, let alone months, can lead to significantly worse outcomes. And remember, it's not your doctor who suffers during those long waits, it's you, living with uncontrolled joint pains, ongoing headaches, uncontrolled diabetes, or other symptoms that may get worse as time goes on. So, you cannot assume that the referral you're given is the fastest or best option. As the expert in the article put it, patients need to specifically ask their primary care physicians for these referrals. They need to fight for themselves. Number 7, you don't have to like your doctor to receive excellent care. A lot of patients think that the most important thing is having a doctor they like. Of course, it's nice to feel comfortable with your physician, but the truth is, you don't always have to like your doctor for them to give you excellent care. Let's say you need surgery. The most important trait in a surgeon isn't how friendly they are, it's their expertise. What really matters is their technical skill, how many times they've performed the exact operation that you need, and whether the hospital they use has low infection rates. A nice personality and good bedside manner are nice extras, but they shouldn't be the deciding factor when choosing a surgeon. The same principle applies to all types of doctors, not just surgeons. It's nice if your doctor is friendly, but your health depends on their skill, not their charm. In fact, sometimes the doctor whose personality feels different from yours is exactly the one you need. If you're a little too laid back, a stricter doctor can hold you accountable and push you toward the gold standard. Normal blood sugar if you're diabetic, well-controlled blood pressure, or finally getting your joint pains and headaches under control. On the flip side, if you tend to be very rigid with your health, stressing over every number, a more easygoing doctor can give you perspective. They can help you let go of unnecessary anxiety and stop you from over-testing or over-treating. When it comes down to it, you don't go to the doctor to make a new friend. You go to get better. Number 8. There is a well-known story about a man who saved for years to take a cruise. To cut costs, he packed a suitcase full of crackers and canned food so he wouldn't have to buy expensive meals on board. Every day he walked past the beautiful dining rooms and buffets, eating his plain meals alone in his cabin. On the very last day, a crew member asked why he never joined the others for meal. The man explained that he couldn't afford them. The crew member was shocked. "But sir, all your meals were included in your ticket." The poor gentleman had gone the whole trip without enjoying what he had already paid for. This is what happens in medicine when patients don't realize what's already covered by their insurance. Many men with low testosterone spend thousands of dollars at cash pay clinics for blood tests and testosterone shots, not realizing that the exact same care is covered by their insurance. Low T or hypogonadism is a medical condition. So blood tests, testosterone therapy, and regular follow-up checks are all part of standard medical care. And it's not just men. Women dealing with menopause symptoms often spend thousands of dollars out of pocket for compounded hormones, thinking that's the only option. In reality, bioidentical estradiol tablets, gels, and patches, as well as progesterone capsules are available at your regular pharmacy and they're covered by insurance. Compounded hormones still have their place, especially when adding estriol or customizing a combination, and sometimes they're even less expensive for things like DHEA or oxytocin. But why pay full price for everything when you can combine the best of both worlds? Use what's covered for free and only compound what truly needs to be customized. So, don't miss out on the free buffet. You're entitled to care already included in your insurance plan. Number 9. If you decide to pay for certain medical tests out of pocket, like advanced genetic testing or whole body scans, you may want to consider using an alias. The reason is simple. Once your personal information is tied to that data, you can't control what happens next. Some genetic testing companies have gone out of business. Some have been sold, and in some cases, private health data has been exposed or stolen. Getting your DNA stolen is much more serious than having a credit card or even a social security number stolen. Your DNA is your entire biological identity, the most personal blueprint of who you are. I even have a patient right now who just brought me the results of a whole body scan he paid for by himself. On the report, the patient name was listed as Darth Vader. When I asked about it, he explained that he wasn't sure what kind of can of worms he might be opening, so he used an alias. Just like genetic testing, a whole body scan can open up a can of worms by uncovering incidental findings that may never cause harm or serious unexpected conditions that you may want to keep private. That's why some people choose to protect themselves with an alias, to guard against insurance concerns and potential privacy breaches. And that leads me to the next secret. Let's say you notice your memory isn't as sharp as it used to be, and your doctor sends you to see a neurologist. Before you head down that road, make sure you've taken care of important legal matters, like writing your will or setting up power of attorney. Legally, a will is only valid if you're of sound mind, meaning you understand what you own, who your heirs are, and the consequences of the decisions you're making. If you wait until there is any question about your memory or judgment, your ability to sign those documents could be challenged. The same principle applies if you plan to get life insurance. Don't go in for a bunch of unnecessary body scans or labs right before applying, because you typically will need to disclose any findings. Even incidental abnormalities that turn out to be harmless may delay approval, cause underwriting red flags, or raise your rates. So the lesson here is about timing. Handle your legal and financial protections first, and then move forward with medical testing. That way, you're not creating complications you didn't expect. Finally, number 11. Doctors and nurses today are experiencing burnout at record levels. They signed up to be healers, not gatekeepers, blocking you from the doctor you want to see or the treatment you need. They're under pressure from all sides. Patients want unrushed visits but don't want to wait. Healthcare systems push them to refer only within the network, and insurance companies dictate what medications can be prescribed while patients want choice. So if your doctor or nurse has made a positive difference in your life, consider showing your appreciation. A heartfelt thank you note can mean the world. Taking the time to express your gratitude directly lets your doctor or nurse know they made a difference in your life, and those words can stay with them far longer than you might realize. Another powerful way to show appreciation is by leaving a thoughtful 5-star review. Your words not only encourage and uplift your doctor, they also spread the word so that others can discover the same care and compassion you received. By sharing your experience, you make your doctor's day brighter and help future patients find the right place for their health. As Edith Wharton said, there are 2 ways of spreading light: to be the candle or the mirror that reflects it. You have the power to spread that light by sharing hope and recognition for your doctor and for everyone still searching for the care they deserve. Please make sure to leave a like and subscribe for more videos like this. This is not medical advice and for educational purposes only. See you in the next one.